Good evening, everyone. So we are just waiting for another couple of minutes for our co-panelists and moderators to join for the first glaucoma session.
Okay, welcome everyone. And now Dr. Parul Ichpujani will present her presentation, Contrast Sensitivity in Patients with Advanced Glaucoma.
Can I have my slides, please? So this is a Glaucoma Journal Club, and we just thought of choosing some articles which we read, and we thought of putting them to practice. So for me, I chose contrast sensitivity, and for a patient who has moderate or severe glaucoma, and if they have to do such a simple task as pouring milk in a white mug, this too seems quite tedious. So for them, they need to have a very distinct contrast to work on. So I'll essentially be talking about the role of contrast sensitivity for detecting glaucoma progression. This was one of the articles which set wheels into motion, and when patients were really asked what they saw, it was not the loss of peripheral field of vision. What they saw was that they needed more light. So essentially, all glaucoma patients complain of reduced contrast, and these 100 patients who were questioned regarding the problems that they faced, one of the most important ones that came out was needing more light. And real life situations are very, very different from reading just the optotypes from a Snellen's chart. So it's very difficult for patients with advanced or moderate glaucoma to maneuver driving or to just even walk around the pavements because the contrast is not very distinct. So the paper that inspired me to work and look at contrast in patients with severe glaucoma was this paper which talked about vision-related performance and quality of life with patients who had rapid glaucoma progression, where rapid glaucoma progression was defined as more than a decibel, 1 decibel loss per year. And they used a contrast sensitivity tool, which is a web-based tool and which is called the Spaeth-Richmond Contrast Sensitivity Test, and which looks not just at the central contrast, but also looks at the peripheral contrast. And what they found was that the patients with rapid visual field progression had significant decrease in contrast sensitivity, which was not detected by pelirobsin, which just looks at the central contrast, but was picked up by SPARCS. So it highlighted the need to look at the central as well as peripheral contrast sensitivity. And there have been other studies also that correlate the drop in contrast with drop in the retinal nerve fiber layer thickness. We have moved way beyond the grating-based charts to the letter charts, and now we have different mobile and computer-based tests, and this newer test uses a web-based tool which checks both central and peripheral contrast, and that's what I've been using since the past couple of years. It is an online test. You just need to log in. There is no charge for the doctor or for the patient to undertake the test. What you get is a printout. What you get is a printout with 4 peripheral quadrants and a central quadrant. All the peripheral quadrants are given a score of 20 each, and the central quadrant is also scored 20. So we have a total score of 100, and we see how it goes. So normally you, me, and anybody who doesn't have glaucoma or any other disorder will have a score from 75 or above, but those with disease will have lower scores. So before we stepped on to looking at, is this tool good enough to detect change in glaucoma, I undertook this small study to differentiate between different grades of glaucoma patients and healthy controls, and we found that it was way better than pelirobsin test, both in sensitivity and specificity. And when it comes to glaucoma progression, essentially till now we have been using visual field, and now we can even start using contrast sensitivity as a tool to detect progression, because in advanced cases there is a floor effect when it comes to the OCT, and there is so much of dampening of the field when it comes to a 24-2 and a 10-2. So for them, I think contrast sensitivity works really better. We need to hear the complaints that our patients bring to us. Most of the patients, once they have an advanced disease, they will complain of a drop in contrast. And once you hear that, I think it's a good idea to start checking the contrast. There are several progression detection woes in advanced glaucoma. As I told you, with visual fields and with OCT, there is a problem with floor effect, and detection becomes extremely, extremely difficult. So I've started using this in my clinical practice. I use this to assess central and peripheral contrast sensitivity. I use this in a few of my patients, 15 patients, and over two years I've followed their results. And I have seen that there is a significant drop in contrast sensitivity. This is how the results look like. This is the central quadrant. We have the central scores and the peripheral scores. So if this is one patient in which, if you see, from baseline to 2 years later, there is a severe drop in the central score, as well as in some quadrants in the periphery. So this actually gives us an idea that we need to change our treatment. Either you can add on a drug or you can take up the patient for surgery. This definitely helps in detecting progression because it is a robust tool. And when SPARCS scores were correlated, they correlated way better than the mean deviation on the visual fields. The reduction of contrast sensitivity is not selective for the magnocellular or the parvocellular pathways that have been cited for glaucoma. So I guess that this precedes loss in visual acuity as well as visual fields. And so I would suggest all of you to try this tool, because timely intervention once the contrast sensitivity starts dropping can actually do wonders for your patient. And I have made a change in my practice. I at least check contrast twice a year in patients with moderate to severe glaucoma. So my take-home message is different contrast sensitivity tests exist. You can use any that you are comfortable with, but at least start using contrast in your patients who have advanced disease, and I'm sure that will help you to change your treatment strategy. Thank you. Yeah, she's here. Yeah. I just need a minute. I now welcome Dr. Yasmin Saeed, and she would be talking about circumferential Schlemm's canal surgery in adult and pediatric glaucoma. Welcome, Dr. Yasmin.
Hello, everyone. Does it move from here? Yeah, not in here, at in the. Oh, do you have to upload it here? I thought there's a link. Okay, I'll go upload it while we take another talk. Maybe. Yeah, it's okay. I'll upload it.
Dr. Noha, are you here? Yeah. Is yours uploaded?